I am Tiffany Capers, and I am the Executive Director of CrossRoads Corporation for Affordable Housing and Community Development. I have always worked in the nonprofit or public sector, and as I look back over my career, I've always worked in places and spaces where I was trying to bring margins to center. So while working at another nonprofit organization in Charlotte, became aware of this opportunity and really became intrigued with both the work that CrossRoads is doing to support the Gray Heights community, but also the reason behind it. A part of what drives this organization is its commitment to social justice and trying to make sure that persons who are quote-unquote living on the economic margins, who might be living on the social margins, really have an opportunity to live a life they deserve. One of the ways I've described what we do is to say we are working on solving a Rubik's Cube, but you have to solve a Rubik's Cube all sides. You can't just choose one. You literally have to be working on all sides simultaneously to solve that puzzle. And that's what we want people to know, that we really are trying to work on all aspects, trying to solve, if you will, all aspects, trying to realize the opportunities, if you will, in all aspects. So we want people to sort of join us in that philosophical bent. Part of what we do is frame our work around social determinants of health. We really fundamentally believe that persons in Gray Heights deserve the same aspects of life that other people do. So the place-based model has basically as its premise that if you bring resources into a geographic location, you can experience transformational change. And that is what CrossRoads is embarking upon. Being a place-based initiative, we only serve the Gray Heights community. We only serve the 3,000 or so folks here, the 1,200 or so households, and we do so with a very quote-unquote broad brush. So we focus on health, housing, economic mobility, education, and social community cohesion. Those are the 5 social determinants of health that really activate our mission, and those are the needs that the community has expressed to us as well. We do that by being a community quarterback organization, which means we're not the entity that's doing all the work. We are the entity who's trying to bring all the work together. We're trying to bring together nonprofit organizations whose missions align with those needs, who are willing to work in an integrated fashion to create this fabric that upholds the community and the dreams that it has for itself. It's easy to feel very isolated as a nonprofit organization. It's easy to feel as though you're fighting the world by yourself, even though you know there are other nonprofits who are doing similar work. United Way really works hard to make sure we don't feel like we're on an island, not just financially, but even sort of psychologically and socially. We feel like we're a part of a larger group and we're trying to make a bigger impact, again, collectively. In terms of the funding that United Way has provided, we are grateful that they've invested in this organization and in turn invested in the people. It also is a great responsibility. We really feel the weight of our mission to do the work, but also to do the work in partnership, to do the work in collaboration.